So like I said before, giving an ergot alkaloid works by making arteries narrow. So they constrict the arteries in the head to bring down that pain from that migraine and to kind of stop that cycle of the dilated arteries. But at the same time, it's going to cause nausea and vomiting, and we have to tell our patients to make sure that they cover their arms and legs, wear something warm because they're going to be cold. All right, the next category of drug we're going to talk about is a category that I like to call the triptan sisters because they all end in tryptin, but it's officially known as the 5-HT receptor and agonists. 5-HT receptors are receptors that respond to serotonin. So whenever you see 5-HT, it's got something to do with serotonin. And so by blocking those receptors, or not blocking, by filling those receptors, the triptan medications will act like serotonin on the body. It talks about this in ATI on pages 277 to 280. And the prototype drug is sumatriptan. There's several of them and they all end in tryptin, but the trade name for sumatriptan is Imitrex. And you can take it PO. You can also take sub-Q injections. They've got a nasal spray, and you can take it transdermally, put on a patch. Whereas the ergot alkaloids treat migraines. The minute the patient feels it, you're supposed to take the medication and it will narrow those arteries. These drugs are both to prevent and treat. So if you use a 5-HT receptor agonist, when it acts as if serotonin would act, filling those receptors causes a serotonin-like action. And that is going to result in those cranial vessels constricting. And it's also going to block those messengers, those chemical messengers that are sending false signals to the pain centers. So they block those neuropeptides that cause that inflammation in the beginning. So once again, like the ergot drugs, take this at the first sign of a migraine. Generally, people who have migraines talk about knowing that a migraine is coming. They'll have a particular feeling. They might hear or see something. Sometimes they'll have what's called an aura, where they'll see things, maybe like light shimmers in front of their eyes, or they'll have a particular sensation. And as soon as you know that migraine's coming, you take your medication. The other meds that you might take for migraines that we mentioned before, the calcium channel blockers and the beta blockers, they act to, when they occupy those receptors, the beta receptors, the calcium channel receptors, they send signals that stop the constriction of blood vessels in the periphery. And that allows blood to be sent to the arms and legs, and that allows the blood to drain from the arteries in the head and relieve that throbbing pain. Some of these other drugs, the tricyclic antidepressants, there's a couple of seizure medications, and the calcium channel and beta blockers have unlabeled uses as migraine meds. And you will see that sometimes where an FDA drug that's approved for something else is shown to help in another area. And we see that with all kinds of medications. And they are so widely reported to cause relief of other conditions that even though the FDA doesn't go through that whole big long drug trial to see if they help, they will allow that drug to be used for another condition on an unlabeled basis. And you'll see this with some of these migraine medications. So here is a slide that has a cartoon about sumatriptan or Imitrex, and you can remember sumatriptan by thinking of the sumo wrestler. The sumo wrestler's attached to an EKG with a blood pressure cuff on, so that reminds us to look for cardiac changes and to check blood pressure. And then it gives this little hints from spelling out Imitrex. So you want to screen the patient for ischemic heart disease. You want to use something like Imitrex or a similar 5-HT receptor agonist with caution, because it can cause cardiac issues. MAOs, which we haven't studied yet, but we will in Chapter 10, can lead to MAOI toxicity. When you first give the dose, you want to take a blood pressure before and after administration, 1 hour. Each person needs to use adequate contraception during therapy. You don't want to get pregnant while you're using Imitrex. Remind the patient to allow for an hour between doses, and Imitrex should not be given more than 2 doses in 24 hours. Evaluate an EKG. If the person starts having chest pain, they need an EKG, and that needs to be evaluated. And this is X out of migraine headache. It's not just to prevent headaches. It will also treat the headache and make it stop.